But we want to get to some breaking news right now, and this is in southern Ontario, where 2 Amazon fulfillment centers have now been partially closed to control COVID-19 outbreaks. Now, the order is from Peel Regional Public Health. It's for Amazon's facilities in Brampton and Bolton, Ontario. New regional rules, they do allow temporary shutdowns of workplaces where 5 or more COVID cases have been detected over a 2-week period. And closures, well, they can last up to 10 days and require affected employees to isolate and refrain from working elsewhere. Now, without legislated paid sick days in Ontario, Peel Health is strongly recommending employers provide paid leave for workers. Now, Amazon has just released this statement about the closures. It reads as follows: "Nothing's more important than the health and safety of our employees and the communities we serve. We have done and are doing everything we can to support them. Our most recent round of mandatory testing confirmed a positivity rate of approximately 1%, and there appears to be little risk of spread within our facility." Now, we'll keep tracking that for you, but these closures do come as Ontario tries to stem its surging COVID-19 numbers. The province reporting 4,094 new cases today. That is slightly down from yesterday. And sadly, there were also 24 more deaths. As Ontario's numbers rise, so is the number of people needing treatment in hospital, and many are even being transferred hundreds of kilometers away, in particular in the Greater Toronto area. Let's bring in Laura McQuillan, who has more on this story. So, Laura, talk to us about how hospitals right now are busy trying to relieve some of the pressure they currently face.
Yeah, they're having to send dozens of patients per day, Michael, to other hospitals that have more room for ICU patients to free up their own ICU beds. What we've learned is that in the past day there have been another 38 patients transferred, and in fact this month 747 patients so far. So this month alone, and we're not at the end of the month yet, there have been more than half of the year's total. Such is the rise in the number of patients needing intensive care beds and the effort to find them a bed somewhere in the province. As you mentioned, could be hundreds of kilometres away. We're talking going from Toronto to Ottawa or to Windsor or to Owen Sound just to try and find room for them on flights and ambulances, as you're seeing there on your screen. Doctors have been warning of this for months, the situation in intensive care units, and an expression I keep hearing is Ontario is on fire, but the fire really is burning the hottest in those intensive care units, to the point where we're having these patient transfers in Ontario, and also where field hospitals are opening up. One at Sunnybrook Hospital set to open its doors on Monday, according to doctors who work at their hospital. You see it there, military-style tents set up in a parking lot. That facility will take in some 84 patients who are recovering from COVID, but the hospital says that it could relieve some other hospitals if they do need to transfer patients there as well, because that squeeze is expected to continue. Right now, 833 patients in intensive care in Ontario. That is around double what we saw at the peak of the second wave, a number that is expected to keep growing. Nearly 3/4 of those patients on ventilators, just to give you an idea of how bad things are. And we have been getting an idea of that from Dr. Shadi Amshala, and he is the head of general surgery at Sunnybrook Hospital, where you saw that field hospital. He's been walking us through what all of this means, the flow-on effects for elsewhere in the healthcare system in terms of surgery particularly. Here is something that he told us.
We have shifted into what we're calling a crisis standard of care. That means that the normal standard of care that Ontarians deserve and expect is no longer an option for many disease processes because of the impact of our COVID-19 patients on our system. Everybody needs to know that there are patients out there who should be having their cancers removed that are sitting with their cancers in their body, waiting patiently to have them taken out. We need to know the gravity of what's happening.
And Dr. Ashamala telling us that he was just in the sense of disbelief when he heard from the Ontario government that they had been waiting to see if the modelling flowed through to intensive care units, because that is exactly where we find ourselves now. The modelling was realised. He is urging the government to do more to stem the number of cases heading into ICU, those measures that we've heard many people talking about, including protecting essential workers, because doctors have been crying out for weeks and months now, Michael. They are so concerned not just about where the intensive care units and the hospitals are now, but where things will go next, because it will be at least a few weeks before any restrictions take a bigger effect in hospitals.
Okay, Laura, thank you for that, or Laura McQuillan.